Dr. Owais Durrani is an emergency medicine physician, and he joins me now from Houston, Texas. Thanks so much for being here with us. In Texas, hospitalizations are increasing faster than at any other time, I understand. What's the situation at the hospitals where you work in East Texas? How bad is it compared to last year?
Yeah, thanks for having me. I think if I give you an example, that'd be the best way to demonstrate it. 2 days ago in San Antonio, the seventh largest city in the United States, there were no emergency medical services for 30 minutes. And so that means essentially if you were in a bad car wreck and you called 911, no one was going to show up. The reason for that is because of how overwhelmed our hospitals are with COVID-19. So when I go into the emergency department for one of my shifts, it's totally common to see a patient that admitted 3, 4 days ago still in the emergency department because there's no ICU or floor beds for them. And so what happens is when those EMS units come to the hospital, they can offload their patients and they're stuck there, and that leaves the system really depleted. On top of that, critical access hospitals and freestanding emergency departments, some hospitals that I work at as well, are in the same situation. They stabilize the patients but can't get them transferred to tertiary centers in places like Houston and Austin. And that's all while we have a COVID-19 Delta surge, an RSV surge amongst children, and we're pulling back on any type of mask mandate, and we're lagging behind when it comes to vaccinations as well.
Wow, that's incredible that there aren't ambulances available at certain times. There aren't beds available. Are you having to transfer patients to other states as well?
Yes, that has been something that, and previously was unheard of and something that we've done quite frequently. I personally have, transferred patients 6, 8 hours away from the initial hospital I'll see them at. Some, patients have needed to be airlifted to other states, and that has its own set of issues that, family members can't go with the patient. It's a scary situation. There's obviously kind of downstream cost issues related with that. And so that's something that we had never been doing, and now we are on a common basis.
Yeah, family can't go with them, with the patients. I mean, if they're kids, what happens?
Yeah, unfortunately, there was a 1.5-year-old that we transferred from one of the hospitals I work at to another state, and the parents had to drive about 6.5 hours to meet that baby. Obviously, it was a traumatic situation for all parties involved, but in order to make sure that that baby was getting the care that they needed, that was our only option at that point.
Oh, that's just heartbreaking. The patients you're seeing, is it right to assume, at least the COVID patients, right to assume that most of them haven't been vaccinated?
Yeah, I personally have not admitted anyone to the hospital that had completed a vaccination series. Now, obviously, there are the rare occurrences that happen, but for the majority of the cases that get admitted to the hospital, they are unvaccinated. They're also much, much younger compared to the patients that I was seeing a year ago. They're, in that 40 to 55 range. They may have one medical condition, but they're requiring high levels of oxygen and close monitoring.
And the fact that in Texas, the local officials and schools have had to clash in court with your governor just to be able to try to stop the spread of COVID by having mask mandates, it must add to the frustration then as a physician who may eventually have to treat some of those same folks out there who are yelling at those meetings against mask mandates.
Yeah, there's been a lot of frustrating policy decisions over the last year and a half, and this one with banning mask mandates and recent guidances from the Texas Education Agency, which doesn't require schools to notify parents if there's a COVID positive student in the class. It doesn't require contact tracing, and even if they do contact trace, the parents can decide for the child to go back to class without any repercussions. And so that combined with this kind of culture war happening around masks and vaccinations is really kind of spilling over into emergency departments. In San Antonio, there was a report of healthcare workers being assaulted over arguments when it came to masks. I personally have thankfully not had to deal with anything like that, but I do have to continuously remind some mask hesitant patients and a family member or two to put their mask on, and it's something that is unfortunately spilling over into our hospitals.
Yeah, well, it's really sad to see. We'll have to leave it there, but thanks so much for coming on, and thanks for all your work, you and all the healthcare workers out there. Dr. Owais Durrani, really appreciate it.
Thanks for having me.